Turning and positioning a client in bed. Definition. It is a technique in repositioning client in bed, and its purpose is it aims to prevent complication that may arise while client is confined in bed. Positions client for comfort and body alignment. Positions clients for a variety of clinical procedures. Equipment: pillows, rolled blanket towels, footboard, hospital bed. Assessment: assess the client's physical abilities, level of comfort, and ability to follow instruction. Check client's chart for diagnosis. Planning: wash hands. Organize and check the device for its function: bed, lifter, trapeze. Raise bed to safe working height and ensure that brakes are applied. Secure all tubes, drains, and IVs. Place or assess client in starting position. Dorsal or supine. Lying horizontally on the back. Slide patient and mattress to head of the bed and remove the pillow. Lower head of the bed unless contraindicated. Turn patient onto his back. Replace pillow. Wash hands and followed by document procedure. Dorsal recumbent. Supine position with the patient lying on back, head and shoulder with extremities moderately flexed, legs may be extended. Slide patient and mattress to head of the bed and remove the pillow. Lower head of the bed unless contraindicated. Turn the patient onto back, assess patient to raise legs, bend knees and allow legs to relax. Replace pillow, wash hands and document procedure. Dichotomy: lying supine with hips and knees flexed and thighs abducted and rotated externally. Rest patient to slide buttocks to the edge of examining table. Left both legs, have patient bend knees and place feet in stirrups. Drape patient. Don't forget to wash hands and also the document procedure. These are several types of Fowler's positions. Low Fowler's position is when head of the bed is elevated 15 to 30 degrees. Semi-Fowler's position is 30 to 45 degrees. Standard Fowler's is 45 to 60 degrees and High Fowler's position is 80 to 90 degrees. Fowler's posture as shown by the patient when head of the bed is raised approximately 15 to 90 degrees. Fowler's posture as shown by the patient when head of the bed is raised approximately 15 to 90 degrees. Slide patient and mattress to head of the bed and remove the pillow. Raise head of the bed to desired degrees. Replace pillow. Slightly raise foot of the bed. Wash hands and document procedures. Orthogeny: the posture is shown by the patient sitting up in bed at 90 degrees angle, sometimes resting forward supported by pillow on over bed table. Elevate the head of the bed to 90 degrees. Place pillow between patient's back and mattress. Place pillow on over bed, table, and assist patient to lean over. Placing head on pillow, and don't forget to wash hands and also document procedure. Tense position, lateral side lying. Position in which patient lies on left side with right knee and thigh drawn upward toward chest. Have the client flex his knees and place his arms across his chest. Place your hands on the client's shoulders and hip on the far side. Spread your feet, flex your knees, place one foot behind the other. While rocking backward, and gently roll the client towards you. Raise the bed side rails and move the opposite side of the bed. Adjust the client until he or she is in correct side lying position. A pillows may be placed to support client's head. Prone position, being in horizontal position when lying face down. Move the client to the extreme edge of the bed. Raise the side rails on that side and move to the other side and move to the other side of the bed. Place the client's near arm under his buttocks with the palm up, bringing his far leg over the leg near you. Turn the client's face away from you. Grasp and client's far hand with your hand and his far hip with your other hand. Spread your feet, flex your knees, and place one foot behind the other, and gently pull the roll the client towards you onto his abdomen. Move the client onto the center of the bed. A shallow pillow support the client's head. Knee, chest, genopectoral. Patient kneels so that the weight of the body is supported by knees and chest. With abdomen raised, head turned to one side, arms flexed. Turn patient onto abdomen. Assess patient to kneeling position, arms and head should rest on the pillow while upper chest rests on the bed. Wash hands and document procedure. Bird position. Position in which head is low, body and legs are on inclined plane. Place the patient's head lower than body, with body and legs elevated and on an inclined, or bed may be elevated and blocks. For performing anal surgery, not used if patient has head injury. Wash hands and document procedure and still record appropriate alignment and position of the patient. Transferring technique. It is use of proper body mechanics and repositioning, lifting, and transferring of the patient safely. Its purpose is possession and prepares the client for a variety of clinical procedures. The movement maintains and restores muscle tone. Equipment: bed, wheelchair, stretcher, pillows, and safety belt. Check the doctor's orders and client's diagnosis and restriction. Assess the client's ability, level of comfort, muscle strength, presence of paralysis, and ability to follow instructions. Identify the client, inform the client about desired purpose and destination. Position stretcher with the head near foot of the bed. Raise the bed to inch higher than the stretcher and lock brakes of bed. Lower the height of the bed and slowly raise the head of the bed if not contraindicated. Place one arm under the client's legs and one arm under the client's back. Slowly pivot the client and put client in sitting position. Allow the client to dangle for 2 to 5 minutes. Bring the chair or wheelchair close to the side of the bed. Place it at the 45-degree angle of the bed. Lock wheelchair brakes and elevate the foot pedal. Put transfer belt and other transfer aid is needed and secured. Lifters' knees flex with back straight and hand gripping each side of transfer belt. Rock each client up in standing position to the count of 3, while straightening hips and legs and keeping knees slightly flexed. Lifter and client's pivot, so the lifter and client's back is toward chair. Lifter still holding the transfer belt. Instruct the clients to use armrest on the chair. Flex hips and knees while lowering into chair or wheelchair. Assisting client from bed to stretcher, 3 assistants. Position stretcher with the head near foot of bed. Raise the bed 1 inch higher than the stretcher and lock brakes of the bed. 3 lifters stand side by side facing the side of the client's bed. The tallest places are under patient's back and shoulders. Second nurses places one arm under the waist tight. Third and shortest lifter places arm legs under the legs. Lifters roll client towards their chest and count of 3. Client is lifted and held against nurse's chest.